Wow, I really wish I learned more about sleep apnea in pharmacy school. I've had a lot of patients ask me about Cpap machines recently, and I just don't feel confident in counseling them. I think I'm going to call my respiratory therapist friend Brittany and see if she can help me out. Hey Brittany, what's up? Are you busy? Can you come in today and maybe show me the wheels and deals about these Cpap machines? Okay, thanks. Thanks for coming in today, Brittany.
Well, of course, I'm glad I could help.
Okay, so I've had this Cpap machine in the pharmacy for a couple of years now, but I'm really not sure how to operate it when someone asks me or has a question about it. Do you care to show me the parts?
Well, of course I can. Well, first you have the actual Cpap machine. Now this is kind of like an air pump. And what this does is that it delivers the air and the pressure that the patient needs, and it comes through this flex tubing right here. And any air that's delivered from the machine is going to go straight into the patient's mask. Now this is a full face mask. You have a couple different options when it comes to face masks, and basically it's going to be the patient's preference. This is a full face mask, so it's going to go over the nose and the mouth. The most important thing about the full face mask is that it has a good seal. You want to make sure that around the nose and around the chin that it makes a good seal. Sometimes with men and facial hair, you have to either make sure that the seal is better or get a nasal mask, and that usually works better.
Okay.
Now the nasal mask only goes around the nose, so that it comes right above the lip. You also have the option of nasal pillows or nasal cushions that fit right into the nostrils.
Okay.
And with those, patients usually prefer those because anybody who's claustrophobic, this kind of scares them away a little bit.
Mm-hmm.
But you also have the straps that go around the head, down the back, and then right here below the ears. And this is where they tighten. So what I tell my patients is to put the mask on first and then kind of slip over the straps, and then if they need to make any adjustments, they can easily tighten it and then feel where it's loose.
Okay.
Now as soon as you turn on the machine, it's going to blow the air, and if there's any kind of leaks, they'll be able to feel it around their eyes or kind of around their mouth. Now with this Cpap machine, there's no humidification. Most Cpaps can have a humidification chamber, which will help them deliver, basically humidification with the air, so it's not so dry. Especially with the full face masks, because they don't have really any kind of circulation in there, it's all coming from the machine. It is good to tell your patients to use distilled water only, not tap water, in their humidification chamber.
Okay.
Now with that, they can either heat it up so it's warm, or they can just leave it at room temperature so it's a little bit cooler. One of the best features about a Cpap machine is that it has a ramp, which means that if a setting is too high for the patient for them to put on right away, they can press the ramp button and it starts out at a lower pressure and slowly builds over a matter of a minute or two. That way it kind of eases them into their sleep.
Okay. Okay, my next question is I have a couple of patients that require oxygen therapy and have nasal cannulas. What do you counsel them on regarding that?
Okay, so a lot of patients actually who need a Cpap machine, they need oxygen.
Mm-hmm.
So one of the best things to do to tell your patients is that to make sure they take off their nasal cannula
Mm-hmm.
before they put on their Cpap machine. Because that cannula, how it goes around your nose, around your ears, it's going to create kind of like, it's going to disrupt the seal. So you're not going to get the full pressure that the patient needs in order to prevent their airway from collapsing. An easy thing to do is they have adapters that you can plug either right here or into the humidification chamber that you can actually attach the oxygen to from the patient's oxygen condenser at home. So that way they're getting their oxygen all throughout the night and they don't have to worry about it.
Okay.
They just need to make sure to remember to put their cannula back on when they take their Cpap off.
Okay. So my last concern is that I also have a patient who he just can't seem to get used to the Cpap machine. I know that he's tried it 3 or 4 times, but each time that he tries it, he can't keep it on for more than an hour or so, and he's not able to sleep. What do you recommend for those patients?
That's actually a pretty common problem. A lot of people, when they first start wearing the Cpaps, the pressure is so different that they're uncomfortable at first. So usually I recommend that my patients at least try it first of all. If they try it and it's hard for them to fall asleep or it's hard for them to stay asleep, then I tell them to slowly wear it throughout the day even if they're watching TV, they put it on to try and get used to it, get their body used to it. If they take naps during the day, start wearing it with naps, and slowly their body will get used to it. And I found that most of my patients can tolerate their Cpap machines and wearing either the nasal mask, the full face mask, or the nasal pillows throughout the entire night. And once people get used to it, I've had the majority of my patients say that they can't sleep without it.
Really?
Mhm.